All right, guys, what a difference a day makes. I actually got out yesterday. I don't know what day it is. Saturday. I got out on March 25th, and I'm home. And we had some support fly from out of state, and I got in much later in the afternoon, but I got here. I ate a whole bunch of Chinese food. They were, on my paperwork, it actually said that I was suffering from malnourishment. And I had been in so much pain before I got here that I probably was malnourishment. It was actually my second diagnosis behind the, let's see. Let me just see. What was my diagnosis? Ruptured aortic aneurysm, unspecified severe protein calorie malnutrition. Now, obviously, that did not get any better in the hospital. The hospital food is atrocious. But I am home with my dog. We've got supervision for the next few weeks, so my husband can go to work and not worry about anything. We actually have a support system now that we didn't have last time, and I cannot tell you how much better I feel. I can't believe I did this again. I mean, honestly, all the time I just think this, and I realize there are so many of you guys that have lost people after less, and I feel a little guilty. But I am so happy to be home. Everything's going to be okay. I do have a checkup, another CTA scan, and an echocardiogram in 3 weeks. I'm going to do all I can to make sure that I don't make it worse so that it can be manageable, and maybe I could get the 6-month thing. Now, obviously, in 3 weeks, if I am worse or it's progressed, then I may have to do the surgery a little sooner than the 3 months that they originally may have determined. But, this has been so hard, but the last time was much harder. I don't even know if doing 2 of these in a year is more beneficial, if you have to, than it is, obviously, I don't know, waiting. But I feel so much better. I have my dog here. My husband was telling me he was pretty ornery, but he literally sat there with his head on my lap, and I tried to show him my scars so he knew that. I think he may have thought that my husband had hurt me or something, and maybe that's why I was giving him a hard time. But obviously I was just in the hospital because I'm with my dog every day, all day, and it's been like that. I work from home for years too, in Colorado, and so he's just used to having me around. So now my goal is I have to use this spirometer, which totally everybody knows these things. They're not the most fun thing in the world, but you basically have to. Now, I'm only getting to 1,000. I didn't practice as much. I may not have done all the things I should do last year in terms of my rehab. And that's simply because we didn't have anyone around to help or do anything in the initial stages. And I just always felt weak. And obviously there was an issue with the pseudoaneurysm and all that stuff. And I don't know if it was just a relic from the last surgery. It was just the stress of being so isolated and not having any support. But this one is going to be so much different. I feel like a human being again. As you can see, I kind of probably look a lot different. And I will, get the editing, and you could see a photo montage of just my progression from day to day, because I showed one of the nurses, and she's like, I've never seen anything like that. Usually the swelling is mostly focused on your arms and legs and feet. And I had that, but I literally had a gigantic face. Now, I don't know if this is just the result of going through this so many times. That's what my vasculature pushes. But at this point, like I said, I am so happy to be home. I'm going to make this better. And I have some recommendations for you ACTA2 people that I'll, obviously push out later. But everything is going to be so much better. And I promise you, I will give you progressive updates every day. I'm in pain, but I actually slept in my bed last night next to my husband, and I got 5 hours of sleep, which is huge after not having any sleep for weeks. All right, guys, just please have hope and never lose it, because it helps a lot. And I hope you are all awesome. Things are better. Take care. Thanks again.